started your timer, and here is your question. Right.
Yes,
If you have
madam.
read and understood, considering it procedural skill station, kindly tell me, how would you prepare the theater listing for these three patients?
Madam, in this scenario, I will keep the list same because I
Okay,
think
why?
that this 1, 2, 3 is because I think that strangulated inguinal hernia is a life-threatening, but not immediate, but it can cause uh, patient life, maybe ischemic and perforation. So this patient should be first
Why would you not consider?
priority
Yes.
on the list because
Why
it is
would?
life-threatening.
Yes, please.
Then I will keep the patient. Just madam, what are you saying? Why would you not?
Why would you not consider the
consider-
patient with diverticular abscess as number one, or patient
yes,
with atrial
diverticular.
fibrillation? Yes.
Diverticular abscess is not life-threatening. It is a dirty case, and I cannot put on the priority 1. So
Okay.
it is not life-threatening. So I will keep him on priority 2. And
Okay.
the last one patient is of course diabetic patient, and diabetic is always in priority, but he is MRCS positive. So MRCS positive will contaminate the other, in fact, the other patient. So I have to keep this patient in the last.
Okay, can you please tell me
That is the
what is the listing according to National Confidential Inquiry Patient Outcome and Death Listing? What are the patients, or what are the conditions which are categorized under emergency surgery?
Yes, madam. Number 1, immediate patient, priority 1, like abdominal aortic aneurysm rupture. Number 2, patient and they are life-threatening and limb-threatening. So they are priority 1. Number 2, life-threatening, but not immediate. For example, ischemic bowel disease, large bowel obstruction, and I have to resuscitate first. Yes. Then patient like appendicitis, priority 3,
Yeah.
urgent.
You told me number 2 is when there is life-threatening, but there is less than 6 hours, and then it becomes more than 24 hours and 7 days and etc. Okay. Considering the patient with diabetes, which patient is
Yes.
that?
Third.
Third one, diabetic patient. Right. Can you please tell me, according to once you're placing, because you want to keep that patient on number 3, patient is diabetic. According to the NICE guidelines, what are the conditions, or what are the perioperative glycemic control guidelines that you have to follow?
Perioperative glycemic control is very important, and
Yes.
I will check the patient glucose level. I will try to keep the patient in priority 1. If there is no MRCS positive, I will
Yes, this is what I
not
wanted to
miss
hear.
the meal more than 1.
Okay.
I will not miss the meal. One patient should not be starved more than 2 meals, and is there, then I will give the insulin infusion, and with the
Yes.
glucose that is 0.45% normal saline plus 5% glucose and 0.15 or 3% KCl.
What
And I
type of
can give
fluid, IV fluid should be given to
2
diabetic
insulin.
patients?
Fluid, madam, I have told you that
No,
0.45
sodium
percent
chloride
normal sodium chloride, yes,
with
0.45% sodium chloride,
glucose
5% glucose, and KCl 0.15%.
or KCl.
Yes,
Okay,
and anesthetists can give subcutaneous. Yes,
can you please tell me what
and
should be the
anesthetists can
target,
give.
yes, target blood glucose level that you'll keep for that diabetic patient?
Madam, either it should not be more than 10, 12.
6 to 10.
In
6 to 10.
higher 6 to 10, 6 to 10, not more than this, not less than this 6.
Okay, number one, you want to keep patient with strangulated inguinal hernia. Patient is also known COPD and has a pacemaker. What are the precautions that you'll keep in your mind with this patient?
First of all, I should not give the pure oxygen to the patient because he has COPD. And the second thing, that pacemaker, I will not use the monopolar diathermy, I will use the bipolar diathermy in this case, and priority 1 of this case.
Yes, if you can classify it like preoperatively and then intraoperatively, then if you can tell me, could there be any difference?
Preoperatively,
Yes.
preoperatively, I will
Preoperatively,
give
you
fluids,
have to
resuscitate the patient.
no patient with pacemaker. You have to check if the patient's pacemaker is working, and you have to check for the information of the device model, date of implant, and any reason that you can gather for the implant should be available or it should be there. And then also you have to review this pacemaker patient afterwards, like in the clinic, and regarding the dependency and extent of any heart failure, any particular safety advice which has been communicated or which needs to be communicated to the anesthetic or the surgical team. So that's why you have to give special precautions. And then those others, the monopolar and those the reasons that you are telling me, that is during operation.
Yes, thank you.
And ECG as well. Okay, can you please tell me, since the first patient, your first patient is COPD, known case of COPD. So what are the precautions or what are the measures that you have to keep in your mind that can lead to complications? And you have to be careful for the risks during surgery.
In COPD
Yes.
patient, first of all, I will try to operate as soon as possible. I will not do the laparoscopic surgery for this COPD patient. Variant was, I don't remember this, and this will be used. And pre-operatively, I will assess the pulmonary X-ray chest, pulmonary function test, and ABGs will be done before operation.
Yes, and post-operatively?
Anesthetist will be.
Post-operatively, what are the things
I
that
will,
you have to keep in your mind?
I will give the patient spirometry, early mobilization,
Yes.
and
Why?
I will not give the
To
opioids.
prevent what can happen?
Prevent atelectasis and
pneumonia, and even can lead to
pneumonia
respiratory failure. Okay, right. Time has gone, but I wasn't done with the question. Your number 2 patient is allergic to penicillin and iodine both. So what alternatives do you have for this patient?
Precaution, I will not give the penicillin like drugs and the cephalosporin drugs, and I will not give.
No, you'll not give, definitely. But what would you give alternatively, please?
Alternatively, I give
instead of
quinolone groups can give quinolone, flagyl, metronidazole can be given.
Vancomycin,
And these are the
cefazoline
drugs.
can be given. Vancomycin, cefazoline can be given. And since patient is allergic to iodine, so chlorhexidine based antiseptics can be used instead. Right, right.
Yes,
Patient with,
yes,
okay.
yes.
One more thing you didn't tell me, the patient who is taking pacemaker, you have to check the warfarin. How would you post-operatively? That's why
Warfarin,
I
yes.
told you, you will do this again, right? You'll tell me next time classification into preoperative or and then post-operative or intraoperative. And then you'll tell me how you'll keep the INR and how you'll manage the warfarin post-operatively.
Yes, madam.
Right. And what more I have to ask you? Overnight, yeah, most of the things I've asked you. I'm just going through the questions to make sure that. Okay, if all these three patients are adults, if there was a child, how would you prioritize child in theater listing?
Pediatrics have also the priority, and I can keep the patient at child patient at level 2 in this case if there is a child
No, child will
after
be
life
prioritized.
threatening emergency.
Child will be prioritized first. Always on number 1 on list. Okay, good.
Will be said.
That will be 2, number 2. Okay.